Hi guys, it's Dr. James from Vets of Geelong, and today I'm talking about ear problems. Ear problems are a classic one we tend to see in the consulting room as vets, and what you'll tend to find they present in different ways. Some pets might present to us rubbing or scratching at one ear or both ears. Some people may have seen something go in, the dog just is twitching a bit and can't keep still. So again, depending on the problem, might be the reason your pet's to us a little bit differently. Typically the vets will have a good look all over it, looking for other problems which might give us further indications, yes, it's something more systemic, or if it's just something in your canal. You'll then find we tend to use an otoscope, so visually looking down the ear canal, and obviously there's different sizes looking down the different size of ear canals which will present to us from a Chihuahua to a Great Dane. Then what will happen is the vets might see something. It could just be a red inflamed ear canal, it could be pus, it could be even something like a little grass seed. So grass seeds occur at different times of the year. What you tend to find is these penetrate through the ear canal, and what they do is they sit there and they cause a lot of irritation of the pet, and we end up having to use devices such as little cocks and so forth to pull them out. Typically the pets are sedated because often they're wriggling around because it's sore. Other times what you might find is an ear is full of pus with grass seeds in, and typically we treat those a little bit differently. Sometimes the ear canals are so sore that pets actually won't let us touch them, so you might have to give them sedatives or pain relief before we can even get into the ear canals. If it's just a case of a simple grass seed, it might just be in and out and we're done. Other times what you'll find the vets might be doing is taking a slide and looking under the microscope, looking for certain types of infection. So it could be like a yeasty infection or bacterial infection. And what you tend to find, we're looking for cocci or rods and so forth, so different types of bacteria, which might then mean we change the type of ear treatment which we use. So some antibiotics preparations or antifungal preparations are daily, some are twice a day, and some are even every couple of weeks. So we're probably using that, guiding with the vet as to what you'll be able to get in your pet's ear and what the pet will tolerate, similarly based on what we can see. Often what we do is once we've discovered some infection, we'll do a recheck. In about 2 weeks' time, it's fairly normal checking for bits and pieces to make sure the ear canal is resolved. Because it's a frustration of ours and the pets when they have lingering ear problems. And often it's because they're hard to get on top of or hard to maintain. If you've got any questions about, your pet when they're in for ear problems, have a chat to the vet, because there are different ways we can use, treat and clean ears. The other thing too is sometimes they might flick you onto an injection of some pain relief or anti-inflammatory, or even some oral medication if the ears are really sore, before we have to sedate or anaesthetise, if they're really that bad. And all pets present to us in a different way. If you've got any questions, have a chat to your vet or myself when you're in, and we'll go from there. Have a good day, guys. Bye.